Hello everyone, my name is Krishnakant Shukla and I am starting this clinical questions videos. So we will do today the hypo and hypothyroidism. These both topics are important in surgery, medicine and somewhat in pregnancy also, that is OBGY. Okay, so just now I gave my exam. So hypothyroidism where most of the common causes, or many of the questions. What is the cause for the edema? What is the cause for the heart rate, high heart rate, or tachycardia, or tachypnea? Okay, so today we will going to start this differentiation between the hypo and hypothyroidism, not the basic one that heart rate बढ़ जाता है, sweating होती है, ठीक है, clinical format. So I thought that studying everything for the in MBBS, that should be able to answer in the clinical exams also, okay, practical exams also. So normal action of the hypo and hypothyroidism we have to see. What is normal action for the thyroid hormones? You know thyroid hormones, okay. So what are normal actions? Normally T3 T4 causes increase in BMI. So if there is a more of the T3 T4 hormone, there will be rise in hunger, okay. BMR बढ़ेगा, बेसिक मेटाबॉलिक रेट बढ़ेगी तो भूख भी बढ़ेगी. सो वी डू मोर फूड, सो देर इज मोर ATP डिमांड. इफ BMR, we need more glucose demand. So for both of these there will be weight loss. See this, more of the hunger but decrease in weight loss because demand is more, okay. तुम कितना भी खाओ उससे तुम्हारा वेट लॉस ही होने वाला है क्योंकि BPR बहुत ज़्यादा है, ठीक है. एंड देयर इज अ वाइस वर्सा इन hypothyroidism, decrease in BMR, so decrease in hunger, but less of the ATP, less of the glucose demand, so there will be increase in weight gain. There उल्टा है थोड़ा सा ये. And increase in peristalsis, normal action, but if there is more of the hormone, there will be diarrhea. So diarrhea will cause malabsorption because there is more of peristalsis, there is no absorption, okay. We need time for absorption na? So for in hypothyroidism there will be ileus means मतलब peristalsis पूरा रुक गया है, मतलब कि पूरा peristalsis रुक गया है, okay. That is called ileus. It is also called a paralytic ileus in some cases, like when there is infection, there is a inflammation of the intestine, small intestine, so there will be stoppage of the peristalsis, okay. That is constipation also, okay. There is increase in heat production normally, but if there is a hyperthyroidism तो उसको बहुत गर्मी लगेगी. So there is vasodilation will lead to sweating will cause more of the moist skin. If you see the hypothyroid patient, he will has moist skin, but if the patient is hypothyroidism, the skin will be dry, scaly भी हो सकता है थोड़ा बहुत, ठीक है. अभी जो T3 T4 है वो it will act on the beta receptors of the heart. What is action of the beta receptors? It will increase the heart rate, increase the cardiac output, and increase the systolic blood pressure. Heart will pump, so there will increase in systolic blood pressure, not diastolic. So one more thing, nervous system. So excited होगा, नींद नहीं आएगी, एंजाइटी होगा उसको. एंजाइटी हम लोग बेंजोडाइजेपिन देंगे, एक्साइटेड रहेगा इन सब लिए भी बेंजोडाइजेपिन देंगे, ओके. देयर इज इंक्रीज इन बीटा रिसेप्टर्स है, मैं थोड़ा शॉर्ट बता दे रहा हूँ, ठीक है. देयर इज इंक्रीज इन हार्ट रेट, इंक्रीज इन कार्डियक आउटपुट, वी विल गिव बीटा ब्लॉकर्स, ओके. एंड देयर इज इंक्रीज इन हीट प्रोडक्शन, वी शुड डू व्हाट, पैसिव कूलिंग, ओके, external cooling, okay. Same for a patient is there is a hypothyroidism, उसको ठंडी लगेगी, okay, because there will be vasoconstriction, okay. vasoconstriction रहेगा तो फिर कार्डियक आउटपुट कम है, क्योंकि कार्डियक आउटपुट कम है तो vasoconstriction होगा ताकि BP मेंटेन रहे, ब्लड प्रेशर मेंटेन रहे. एंड देयर विल बी डिक्रीज इन सिस्टोलिक ब्लड प्रेशर, डिक्रीजिंग कार्डियक आउटपुट विल लीड टू चेस्ट पेन, दैट इज एंजाइना, ओके. ऑल्सो पेशेंट कुछ कर नहीं रहा है, वेसोकंस्ट्रिक्शन है, पूरा कॉन्स्टिपेटेड है, तो क्या पेशेंट आराम से बैठा रहेगा, सोया रहेगा, स्लीप डिप्रेशन में जाएगा वो. ऑल्सो दिस वेरी इंपॉर्टेंट, माइक्रोग्लॉसिया, देयर इज अ इंक्रीज इन साइज ऑफ टंग that will fall behind when the patient sleeps, there will be obstructed sleep apnea, okay. Also anemia, alopecia, ascites, madarosis. Why there is anemia? You find the cause, okay. And what is madarosis? You will learn this in ophthalm. साइड पे जो हेयर्स होते हैं वो गायब हो जाते हैं. तो दिस इज़ द क्लिनिकल साइन, यू हैव टू जस्ट इमेजिन ये पेशेंट कैसा आएगा. सो व्हाट इज हाइपरथायराइडिज्म इज व्हेन द पेशेंट इज रनिंग, भूख बढ़ेगी, वेट लॉस होगा, वही तो मेन कॉज है भागने का, ओके. don't think of the peristalsis. Okay, he will feel heat, and also he will be moist, okay, and excited. Okay, so we will go for the hypothyroidism first. Okay, what is the question? 50-year-old female present with the weight gain, cold intolerance, constipation, and lethargy. This is hypothyroidism. You know the answer, but more important over here is how to treat the patient. Okay, she has dry skin and hair loss. Same finding that I have told over here. Okay, so on examination I found the bradycardia, मतलब 60 से लेस उसकी हार्ट बीट रहेगी. पफी फेस, इडीमा है, ये तरह से डिलेड एंकल रिफ्लेक्स रिलैक्सेशन. ठीक है, ये होता है. ये बहुत ही बेसिक फाइंडिंग है इन हाइपोथायराइडिज्म. ओके, सो what it will be, this hypothyroidism. What is diagnosis? Hypothyroidism investigation is T3, T4, T3 TSH high and T4 low. Okay, you know hypothyroidism, the hormones released by the thyroid gland is reduced, but the center of action from the pituitary gland, it says TSH निकाल रहा हूँ भाई तो प्रोड्यूस कर. And then what would investigate? What would the most common cause? It would be Hashimoto's thyroiditis. And what would be treatment? Is levothyroxine. It has more of the things primary. So if we do the evaluation of the hypothyroidism, what we will do? We see the TSH is high, so we will go for the evaluation of the T4. Okay, what is more potent, T3 or T4? You tell me. Okay, so if T4 is normal or can be low in hypothyroidism. If it is normal, so it is subclinical hypothyroidism, means clinical symptoms are not seen. Okay, so we have to see for the anti-TPO antibodies, TSH more than 10, and if the patient is pregnant or the symptoms are present or not. If symptoms are present, so you have to give levothyroxine. अगर symptoms नहीं है तो कोई ट्रीटमेंट की जरूरत नहीं है, फॉलो अप रखो उसको. If TSH is low, means it is primary hypothyroidism. Okay, there are primary, secondary, tertiary hypothyroidism. You can find this in book. Okay, so if there is primary hypothyroidism, we should check the anti-TPO antibodies. ठीक है, thyroid peroxidase antibodies. If it is present, it is Hashimoto's thyroiditis. You have to give levothyroxine sodium. Okay, it is doses depend on the age, weight, severity, pregnancy, and all. Okay, so if symptoms are absent, find the other causes. Okay, so these are the basic things you can find in book. Most of the treatment is levothyroxine sodium. You can find in book. Most of the treatment is levothyroxine sodium. You have to give the thyroid hormones. Okay. So we will go for the mixed edema. What is mixed edema? If hypothyroidism happens in child or infancy, it is called it causes mental retardation. So it is called as cretinism. If it occurs in the adults, it is called as mixed edema. It is hypothyroidism. Okay, so mixed edema. What happens in mixed edema? Mixed edema में hypothyroidism होता है. ये तो basic cause है. It also causes the supraclavicular and periorbital puffiness. Okay, it also causes yellowish skin tinge and malar rash, and loss of the hairs over the and purplish lips, and also the scanty eyebrows that are told. In hypothyroidism, in mixed edema, the most easiest finding that we can find, we can check over here is cool skin. Okay, so it was mixed edema. What is mixed edema? कोमा. यही mixed edema में ऐड कर दिया हम लोग अगर हाइपोथर्मिया, that is hypothermia, hypotension and altered consciousness. कोमा में क्या होता है? कॉन्शियस अल्टर्ड रहता है. तो हाइपोथर्मिया, हाइपोटेंशन और altered consciousness. What is hypothermia? Cool skin से बोला मैंने. Okay, so we have to treat the patient accordingly. And also mixed edema is the most common cause for the non-pitting edema. क्यों? क्योंकि इसमें म्यूकोपॉलीसैकेराइड्स का डिपोजिशन होता है. उसको प्रेस करेंगे तो वो नॉन पिटिंग होता है. मतलब कि दबाऊंगा दब जाएगा लेकिन वो फिर से ऊपर आ जाएगा. पिटिंग में क्या होता है? 15 to 30 सेकंड दबा के रखना होता है. फिर वो जितना देर तक दब के रहेगा, कितने ऊपर आ रहा है, उससे ग्रेडिंग होती है. उस वजह से उसको हम बोलते हैं पिटिंग एडिमा. In practical, most of the people have asked for the causes of the pitting edema, non-pitting edema, fast edema, slow edema. Okay. So I will tell you the what is treatment for this. I told you hypothyroidism, so we have to give T4 hormones. I told you hypothermia, so we have to do the passive rewarming. Okay, and I tell the hypotension. So in hypotension we have to give the crystalloid. Why hypotension? Because of the decreased cardiac output, decreased systolic blood pressure. Okay, we have to do the crystalloids. It also causes the hypoglycemia, so we have to give the glucose. In hyponatremia, we have to do the saline. Okay, and in hypoventilation you have to intubate the patient. If patient not able to breathe, intubate the patient, mechanical ventilation करना पड़ेगा, and monitor the cardiac output because there is a decreased cardiac output. But one more thing, why there is hyponatremia over here? You should ask question, why hyponatremia, why hypoglycemia. Okay, when there is a decrease in there is severe hypothyroidism, there is a decrease in cardiac output, it causes a decrease in BP. So body thinks that decrease in cardiac output due to the severe hypothyroidism causes the body thinks that there is a low blood volume. So low blood volume body thinks, so it causes release of the ADH. What causes ADH? Anti-diuretic hormone, means it decreases the urine output. Okay, decreases the urine output, so it causes water retention. वाटर जहाँ रहेगा उसके पीछे सोडियम भी रिटेन हो जाएगा. सोडियम रिटेन हो जाएगा तो फिर अब यहाँ पे सोडियम रिटेन हो रहा है, तुम बोलोगे कि सोडियम बढ़ना चाहिए था, लेकिन इट कॉजेज वाटर रिटेंशन. इतना सोडियम, इतना सारा वाटर, सो इट कॉजेज डाइल्यूशनल hyponatremia. Okay, it causes cerebral edema, it causes consciousness. Okay, decrease in consciousness, there is altered consciousness. Okay, you got this point? Okay, so going further for the hyperthyroidism, we go to the next question. 32-year-old female presents with the weight loss despite increased appetite. यहीं से मालूम पड़ जाना चाहिए कि इट इज़ हाइपरथायरॉयडिज्म. ओके, हीट इनटॉलरेंस, बहुत गर्मी होती है. एक्सेस स्वेटिंग, हीट की वजह से स्वेटिंग हो रही है उसको. पाल्पिटेशंस, इरिटेबिलिटी. पाल्पिटेशन मीन्स पाल्पिटेशंस के डीडीज में याद होना चाहिए. ओके, इरिटेबिलिटी फॉर 3 months. शी हैज़ ट्रेमर्स. मेंस्ट्रुअल इरेगुलरिटी से कुछ भी फायदा नहीं पड़ता है. हाइपोथायराइडिज्म में हाइपोथायराइडिज्म दोनों भी ऊपर नीचे होता रहता है सब. इट्स हार्मोनल चेंजेस. सो डोंट जज अ पेशेंट ऑन द मेंस्ट्रुअल इरेगुलरिटी वेदर इज हाइपर और हाइपोथायराइडिज्म. ओके, ऑन एग्जामिनेशन पल्स इज हाई, मोर देन 100, सो इट इज टाइकार्डिया. वार्म, मॉइस्ट स्किन, डिफ्यूज गोइटर एंड फाइन ट्रेमर्स. थोड़ा थोड़ा सा होता रहेगा. ओके, सो मोस्ट लाइक डायग्नोसिस इज thyrotoxicosis. Why this is happening? Because of the excess thyroid hormone. Investigation by TSH low or T3 T4 high. You have to find the cause. It doesn't imply that TSH low there will be T3 T4 high. Okay, don't connect both the things. What will the treatment over here? You have to give the beta blockers and carbimazole. Okay, why beta blockers? Because there is tachycardia, so we have to stop the high heart beating. Okay, and for the okay, so treatment for the thyrotoxicosis is beta blockers and carbimazole for the anti-thyroid drugs. Okay, so what is the difference between thyrotoxicosis and what is hyperthyroidism? Hyperthyroidism is just increase in the hormones, and if it presents clinically it is called as thyrotoxicosis. Okay, this much is the difference. So thyrotoxicosis may be primary hyperthyroidism, thyrotoxicosis without hyperthyroidism, and it will be secondary thyroidism. Okay, we have to know the cause of the primary hyperthyroidism, secondary hyperthyroidism, primary thyrotoxicosis, secondary thyrotoxicosis. Okay, you have to know the cause. All things are different. Okay, these are asked in the surgery mostly. We will go for the thyrotoxic crisis. So what happens over here? Also, before going for that, we should know the eye signs of the hyperthyroidism. Why hyperthyroidism signs occurs? We should say NDVMSJ. These are the trick for you. I made this. So Nafziger sign is exophthalmos, Dalrymple sign, von Graefe sign, Mobius sign, Stelbach sign, and Joffre signs. You have to learn this, okay? You have to make it remember. So most of the cause over the hypothyroidism is Graves' disease, okay? Graves' disease. What is Graves' disease? It is an autoimmune disease that causes the release of the specific antibodies that stimulates the receptors, okay? It is TSH receptor का antibody, but it stimulates it, okay? So how Graves' disease occurs? When there is any infection by E. coli or Yersinia or any other things that causes the release of the receptors against that bacteria, the antibodies are released. But those antibodies that are on the E. coli or these bacteria that resembles the TSH receptor that are present on the our thyroid gland. Okay, so वो उसको जाके मारने लग जाता है या फिर उसको स्टिमुलेट कर देता है. So it causes the TSH receptor to act more and to release more of the hormones that are T3 and T4. Okay, so इसमें भी चेक कैसे करना है? पहले देखना है TSH लो है कि नहीं. If TSH are low, you have to check for the T3 and T4. If they are normal, it is subclinical hyperthyroidism. Okay, if there is more of the T3 and T4, it is hyperthyroidism. So if signs are present, it will be Graves' disease. If they are absent, think of the adenoma, कहीं और से निकल रहा है, सेकेंडरी हो सकता है, मल्टीनोडल क्वार्टर भी हो सकता है. Okay, so here most of the drugs we have to give over here is thyrotoxicosis ना. इसमें क्या होता है? We will learn over here. Okay, go for the clinical question first. Thyrotoxicosis, 35-year-old female, known case of the hyperthyroidism for 2 years. उसको ऑलरेडी हाइपरथायरॉइडिज्म था. हाइपरथायरॉइडिज्म रहेगा तो हम उसको कौन से ड्रग पे रखेंगे हम लोग? T3 T4 ज़्यादा है, एंटी थायरॉइड ड्रग्स. ओके, एंटी दैट आर एंटी थायरॉइड ड्रग्स ना. वो क्या है? PTU है, कार्बीमाजोल है and methimazole hai. Okay, and also we can do for the radioiodine ablation that we have studied in the second year pharmac. Okay, these are not big things. Okay, and we should go for we can go for surgery, but before going for surgery we have to look for the we have to make the patient normal thyroidism. Okay, so for that we have to prepare the patient with the propranolol, atenolol also, and we have to check for the post-op hypothyroidism, hypoparathyroidism, decrease in calcium or recurrent laryngeal nerve का damage. Why? When there is a surgery, we have to hypothyroidism में क्या होता है? अभी हमने सर्जरी की, वहाँ से हार्मोन निकल गया वहाँ से, तो क्या होगा? हाइपोथायरॉइडिज्म हो जाएगा उसको. हार्ट रेट बढ़ जाएगा, तो ब्लीडिंग बहुत ज़्यादा होगी. तो ये बेसिक अंडरस्टैंडिंग रख के हमें याद करना है इसको. ठीक है. सो व्हेन देयर वी रिमूव द थायरॉइड ग्लैंड, इट ऑल्सो हैज ए स्मॉल 4 पैराथायरॉइड ग्लैंड. इफ यू रिमूव दैट ऑल्सो, दैट विल कॉज टेटनी इन द पेशेंट बिकॉज ऑफ द hypokalemia, hypocalcemia, sorry. Okay, so we should go for this surgery, and before surgery we have to do the preparation. You should learn this preparation that are asked. This is asked in the practical exam, also in the theory exams also. So here patient is already hyperthyroidism, in drugs पे होंगे already वो. Okay, present for the emergency in high grade fever. ठीक है, hyperthyroidism, high grade fever, severe palpitations, fever बढ़ गए, agitation for the 1 day. She stopped her anti-thyroid drug medication recently. अभी इसने एंटी थायरॉयड ड्रग्स स्टॉप किया, तो थायरॉयड विल रिलीज मोर ऑफ द ड्रग्स ना, मोर ऑफ द ड्रग्स. सो दैट विल कॉज द सीवियर पाल्पिटेशन, हाई फीवर एंड एजिटेशन. सो वी हैव टू गिव द पेशेंट एंड ऑल्सो शी हैज ए हिस्ट्री ऑफ रिसेंट इन्फेक्शन. रिसेंट इन्फेक्शन से वही इकोला रहेगा, रिसेप्टर से क्या होगा? स्टिमुलेट टाइप ऑफ द एंटीबॉडीज बनेंगे. That similar type of antibodies will cause release of the more of the T3 T4 hormones. Okay, so on examination we found that there is a high temperature, pulse was tachycardia, and BP was also high. She was restless and confused, profuse sweating. These all are signs for the increase in T3 and T4 hormones. Okay, and diffuse goiter was present, and ECG we can see the atrial fibrillation. Because it was atrial fibrillation, it was irregular. Okay, if you want video on the atrial fibrillation, ventricular tachycardia, or based on the ECG also, you can comment down on the video. Okay, I will make the video, I will try for it. So there was increase in T3 T4, so it is thyroid storm. Why thyroid storm? Because she is already hyperthyroid and she dropped the drugs, so there is a suddenly rise in hormones the T3 and T4, that has caused thyroid storm or thyrotoxic crisis. Crisis because patient is very ill over here. Okay, so what are precipitating factors? She stopped the antithyroid drugs and she also had the infection. Okay, so she stopped the antithyroid. What will be treatment? So obviously thyroid antithyroid drugs हो, वही PTU, कार्बीमाजोल, मेथीमाजोल वैसे देंगे हम लोग. अब इन्फेक्शन हुआ था, इन्फेक्शन हम लोग ट्रीट करने के लिए बस एंटीबायोटिक्स देंगे हम इसको. अदर कॉज क्या, सर्जरी हो गई, ट्रॉमा हो गया, डायबिटिक कीटोसिस, इसको मैंने पढ़ाया था, तुम्हें पढ़ना है इसको कैसे. पैथोफिजियोलॉजी क्या यहाँ पे, सडन इंक्रीज इन सर्कुलेटिंग हार्मोन्स, हाइपर मेटाबॉलिक स्टेट आ गया इसमें, तो मल्टी ऑर्गन डिस्फंक्शन होने लगा इसमें, वही है, समझ गए. इन्वेस्टिगेशन क्या है यहाँ पे, TSH लो एंड T3 T4 हाई, ECG में अरिथमिया, ओके. ECG we do in one more thing, whenever there is MI, to rule out the hypo or hyperkalemia, we should do the ECG. Okay, ECG is very important for the mostly cardiac causes and also the hyperkalemia cases. Okay, what will management? We have to treat this patient very recently. Okay, so how we will treat the patient? First of all, we will make the patient ICU admit करना पड़ेगा. So में we have to rehydrate the patient, we have to get the antibiotics, and we should treat the patient for the hyperthermia. So we should give the acetaminophen, that is more preferred than the aspirin. Tell me what is the difference between the PCM and the acetaminophen. Okay, so अभी उसको palpitation, severe palpitation, tachycardia, तो हमें we have to give the beta blockers, that is propranolol. If she has asthma or airway related problems, so we have to give the atenolol or metoprolol. Okay, we can't give the propranolol. This is very basic question. Okay, esmolol is more preferred than the propranolol. Okay, antithyroid drugs, what will be antithyroid drugs? PTU, carbimazole. Okay, you can give the iodine, you have to give the iodine, you have to give the hydrocortisone, you have to give the cooling and IV fluids also over here. So tell me the functions of the sodium iodopate cholestyramine. Cholestyramine causes the decrease in enterohepatic circulation of the T3 and T4. Okay, benzodiazepine for the agitation also. We have to give digoxin for the cardiac failure. When there is cardiac failure, we have to give the digoxin. And plasmapheresis is to remove the all the hormones over here. And lithium causes the reducing production of the okay. What is complication over here? There is an atrial fibrillation, AFib happening over here. That can cause the cardiac failure, and it also causes arrhythmia. It can also cause a shock over here. Okay, these are the common findings over here. You have to understand the hypothyroidism, and accordingly we have to treat the patient. Okay, so this is very easy one. We can start with the next question over here. So moving to the next question, we should start now. Addison's disease or adrenal insufficiency. What is this? So what is Addison disease? So name Addison was given by scientists who found that some patient has low BP, hyperpigmentation, and other findings like the weight loss, hypoglycemia also. So we will study now. So what is adrenal insufficiency? It could be primary or secondary. If the cause is from the adrenal gland, it is primary. If the cause is from different from the brain or some other such as that causes the abdominal of the steroids, and from the hypothalamus or pituitary defect, is called the it will be secondary cause. Okay, then primary disease could be when Addison found that disease, it is mostly was associated with the TB patient. What causes TB? TB destroys the adrenal gland. So because of that, there is no secretion of the mineralocorticoids, glucocorticoids, and sescorticoids, that is testosterone. So what is normal function of the Addison adrenal gland? Okay, so there are three layers of the over here I can say over here. So first is glomerulosa, fasciculata, and reticularis. So what is the function of the glomerulosa? It secretes the mineralocorticoids. What is the function of mineralocorticoids? It releases the aldosterone. What causes aldosterone? Aldosterone normal function is increase the absorption of the sodium. Okay, if there is increase absorption of sodium, it will bring this water also. This causes increase in the IV intraventricular fluid, and also cause the activation of the RAS, and it will reduce the renin. This whole pathway is going along together. Okay, so what is function of the fasciculata? It releases the glucocorticoids, that is cortisol, and that increases insulin sensitivity. So when there is a increase in glucocorticoids, it will increase insulin sensitivity, it will use the glucose. Okay, use the glucose, and the body function will be maintained. Okay, and in the reticularis, it is a testosterone, it maintains the libido of the patient. Okay, so what happens if there is a adrenal insufficiency or Addison disease? It causes damage of the adrenal gland, so it will reduce the adrenal functions. So there will reduce in the functions of release of these three hormones: aldosterone, cortisol, and testosterone. Okay, glucocorticoids, mineralocorticoids, and testosterone. For treatment of this patient, we have to treat the symptomatic and also give these hormones to the patient. Okay, it is एंटागोनिस्ट टू दी कुशिंग सिंड्रोम. कुशिंग सिंड्रोम में कॉर्टिसोल हाई होता है, यहाँ पे कॉर्टिसोल लो हो रहा है. व्हाट इज कॉर्टिसोल? दिस ग्लूकोकॉर्टिकॉइड. ओके, सो व्हाट विल बी दी symptoms of the patient? So when there is a decrease in aldosterone, there will be decrease in the sodium absorption. सोडियम absorption कम होगा तो वाटर भी कम आएगा, तो उसकी वजह से लो बीपी हो जाएगा पेशेंट का. ओके, एंड ऑल्सो बिकॉज दी hyponatremia, it will not absorb the water, not of the sodium, because it decrease in BP. It also causes salt craving, because बॉडी में सोडियम नहीं है तो बॉडी बोली कि मुझे और सॉल्ट चाहिए. ओके, एंड इट विल ऑल्सो कॉज दी व्हेन देयर इज लो सोडियम देयर विल बी हाई पोटेशियम. ओके, ये उल्टा चलता रहता है. और सोडियम कम हुआ तो मेटाबॉलिक एसिडोसिस. So in metabolic acidosis, there will be increase in CO2 in the blood. So patient complains by hyperventilating. CO2 को ब्रेथ से बाहर निकालने ट्राई करता है. ठीक है, सो दिस अकर्स इन मेटाबॉलिक एसिडोसिस. ये हो गया हमारा मिनरलोकॉर्टिकॉइड फंक्शन. उसके बाद में आते हैं हमारे पास ग्लूकोकॉर्टिकॉइड फंक्शन. ये क्या करता है? इंसुलिन की सेंसिटिविटी बढ़ाता है टुवर्ड्स ग्लूकोज. ग्लूकोज यूज़ होगा, लेकिन जब ये रिलीज़ नहीं होगा तो इसकी वजह से क्या होगा? इंसुलिन कम रिलीज होगा या फिर सेंसिटिविटी कम हो जाएगी. इसकी वजह से हाइपोग्लाइसीमिया हो जाएगा पेशेंट, फास्टिंग हाइपोग्लाइसीमिया. ओके, भूख भी कम लगेगी इसको और वेट लॉस होने लगेगा इसको. ठीक है, एटलीस्ट इट इज़ नॉट डिक्रीज इन ग्लूकोज, इट इज़ इंसुलिन सेंसिटिविटी. ग्लूकोज है बॉडी में लेकिन उसका वो यूज़ नहीं कर पाएगा. ओके, सो व्हाट हैपेंस ओवर हियर, ये हो जाएगा. तो फिर अल्डोस्टेरोन हो गया, कॉर्टिसोल का हो गया, फिर टेस्टोस्टेरोन का फंक्शन, डिक्रीज इन लिबिडो एंड लॉस ऑफ द एक्सिलरी एंड प्यूबिक हेयर्स हो जाएगा इसमें. अभी एक्सिलरी हेयर, प्यूबिक हेयर कैसे ग्रो होता है ये हम ओबीजी में पढ़ेंगे. ओके, तो मैंने पढ़ा भी होगा इसमें. ठीक है, ओके. उसके बाद में ACTH, अभी हमारा जो ये ग्लैंड है, जो हमारा पिट्यूटरी ग्लैंड है, ये रिलीज़ नहीं कर रहा हार्मोन को, तो ब्रेन विल टेल increase it more by secreting the ACTH. What causes ACTH? ACTH, if this excess, it also acts as a melanocyte stimulating hormone. So there will be increased pigmentation of the knuckles. Okay, tell me one more duty where they say increase in pigmentation of the knuckles. Something vitamin is there. Okay, पता करो B12 है. So here, what will you give the treatment to the patient? तो यही सिम्टम्स है. विल स्टार्ट रीडिंग द क्वेश्चन. 35-year-old female present with progressive weakness, weight loss, loss of appetite. For 6 months, she complains of dizziness on standing. It is postural hypotension because of the decrease in BP and salt craving due to the decrease in sodium absorption, and BP was also low, and hyperpigmentation of the knuckles. It was the ACTH release. So every symptom should match for the clinical picture, and we have to treat the patient also. You should know the pathology why this is happening in these days only. So then only you can diagnose the patient. Okay. So here what you will see, लैब डायग्नोस क्या देखेगा मुझे? हाइपोनेट्रिया मिलेगा, डिक्रीज सोडियम, हाइपरकलेमिया, एंटागोनिस्ट रहेगा उसका. सो व्हाट विल बी द डायग्नोसिस ओवर हियर? एडिसन डिजीज. हार्मोन कौन सी कम है यहाँ पे? कॉर्टिसोल एंड अल्डोस्टेरोन डिफिशियंसी. ओके, एंड कॉज ऑफ द हाइपरपिगमेंटेशन बिकॉज इंक्रीज ACTH रिलीज, एंड इन्वेस्टिगेशन मुझे कॉर्टिसोल मुझे कम मिल जाएगा उसमें. ठीक है, सो how will you know that is primary or secondary aldosterone insufficiency, Addison disease? Primary or secondary Addison disease. We will see for the pituitary defect is present or not. So if the pituitary is normal, we should go for the ACTH. If ACTH is high, means pituitary was normal. So what will cause ACTH higher रहेगा तो फिर ये stimulate करेगा अपने glands को. So here we will see aldosterone, testosterone and cortisol level low. You can see, but renin will be high. Why? Aldosterone increases the absorption. If there is a low aldosterone, no absorption will occur. IV fluid will decrease. RAS will okay. So what I told you, normally aldosterone causes absorption of the sodium. So उसकी वजह से वाटर फॉलो करेगा तो IV फ्लूइड इंटरवेनस फ्लूइड बढ़ जाएगा. सो इसका रास एक्टिवेट हो जाएगा. जब फ्लूइड बढ़ेगा रास एक्टिवेट होगा तो इसको रास एक्टिवेट होगा तो रेनिन लो हो जाएगा. बट aldosterone इज लो, सो रेनिन विल राइज. दैट्स व्हाट हैपनिंग इन द प्राइमरी एडिसन्स डिजीज. इफ देयर इज अ डिफेक्ट इन द पिट्यूटरी तो ACTH लो होगा. ACTH लो होगा तो रेनिन aldosterone वैसे भी नॉर्मल रहने वाला है और टेस्टोस्टेरोन और कॉर्टिसोल लो होगा क्योंकि रेनिन एल्डोस्टेरोन आपस में खेलते रहते हैं लोग, ठीक है. और टेस्टोस्टेरोन कॉर्टिसोल ये ब्रेन से स्टिमुलेट होकर आता है, इट होता है. सो व्हाट विल ट्रीटमेंट ऑफ हियर? फॉर ट्रीटमेंट वी शुड गिव दी ग्लूकोकॉर्टिकॉइड्स. ग्लूकोकॉर्टिकॉइड्स लो है तो हम उसकी वजह से हाइड्रोकॉर्टिसोन देंगे. मिनरलोकॉर्टिकॉइड्स लो है, मिनरलोकॉर्टिकॉइड जाएगा तो इसलिए हम लोग फ्लूड्रोकॉर्टिसोन देंगे. बट फर्स्ट वी शुड ट्रीट द पेशेंट विद द general management. We should resuscitate the patient. We should give the IV glucose fluids. Okay, and long-term treatment will be glucocorticoids or hydrocortisone and mineralocortisone, and you get the steroids also. What are short-acting, long-acting, medium-acting steroids? You have to learn this. Okay.